Imagine a world where HIV is no longer a life sentence, but a manageable condition. A world where early detection and modern treatments allow men to live full, healthy lives despite an HIV diagnosis. This isn't science fiction, it's our reality in 2024. But here's the catch: you need to know what to look for. In this eye-opening video, we're diving into the 10 symptoms of HIV in men that could save your life. From subtle changes you might brush off to signs you can't ignore, we're breaking down the latest science on HIV detection. Plus, we'll explore how PrEP is revolutionizing HIV prevention and why getting tested is easier and more important than ever. For men, recognizing the potential symptoms of HIV can be life-saving. In this comprehensive guide, we'll explore 10 key symptoms of HIV in men, backed by scientific research and expert insights. Remember, these symptoms can also be caused by other conditions, so it's essential to consult a healthcare professional for proper diagnosis and care. A landmark study in The Lancet HIV, 2023, found that people diagnosed with HIV who start treatment promptly can now expect to live nearly as long as those without the virus. This is game-changing, but it hinges on early detection. Meanwhile, a 2022 review in the New England Journal of Medicine showed that when taken as prescribed, PrEP reduces the risk of getting HIV from sex by about 99%. It's like a force field against HIV, giving men unprecedented control over their sexual health. Now let's get to the heart of the matter. Here are 10 symptoms of HIV in men you need to know. Flu-like symptoms. The initial red flag. One of the earliest and most common signs of HIV infection in men is a cluster of flu-like symptoms, often referred to as acute retroviral syndrome, ARS. This typically occurs within 2 to 4 weeks after exposure to the virus. Key symptoms include fever, chills, night sweats, muscle aches, fatigue. A study published in the New England Journal of Medicine found that up to 80% of people newly infected with HIV experience these flu-like symptoms. However, it's important to note that not everyone will have noticeable symptoms during this early stage. Dr. Michael Saag, director of the University of Alabama at Birmingham's Center for AIDS Research, explains, "The initial flu-like illness is the body's natural response to the virus. It's essentially the immune system recognizing a foreign invader and mounting a defense. These symptoms typically last for a few days to a couple of weeks. Many men might dismiss these as a common cold or flu, which is why it's crucial to be aware of potential HIV exposure risks. Swollen lymph nodes. Your body's silent alarm. Lymph nodes are an essential part of your immune system, and their swelling can be a telltale sign of HIV infection. In men with HIV, swollen lymph nodes, lymphadenopathy, often persist long after other flu-like symptoms have subsided. Common areas for swollen lymph nodes include neck, armpits, groin. A study in the Journal of Acquired Immune Deficiency Syndromes found that persistent generalized lymphadenopathy was present in up to 90% of HIV-positive individuals during the early stages of infection. Dr. Lisa Sturman, an HIV specialist in San Francisco, notes, "Swollen lymph nodes that persist for weeks or months without any other obvious cause should prompt consideration of HIV testing, especially in individuals with known risk factors." Skin rashes and sores. More than skin deep, skin changes are common in HIV infection and can manifest in various ways. These dermatological symptoms can range from mild rashes to more severe conditions. Common skin issues associated with HIV in men include seborrheic dermatitis, similar to severe dandruff, psoriasis, molluscum contagiosum, small, flesh-colored bumps, Kaposi's sarcoma, purple-red skin lesions, more common in advanced HIV. A comprehensive review in the American Journal of Clinical Dermatology highlighted that up to 90% of people with HIV will experience at least one skin condition during the course of their illness. Dr. Robert Brodell, chair of the Department of Dermatology at the University of Mississippi Medical Center, emphasizes, "Any unusual or persistent skin changes, especially when accompanied by other symptoms, should be evaluated by a healthcare provider." In some cases, skin manifestations can be the first visible sign of HIV infection. Rapid weight loss. When pounds melt away, unexplained rapid weight loss is a significant concern and can be a symptom of HIV, especially as the disease progresses. This weight loss, often referred to as HIV wasting, can occur even without changes in diet or exercise. A study in the journal AIDS found that weight loss of more than 10% of body weight is associated with increased mortality in HIV-positive individuals. Dr. Carlos Malvestuto, an infectious disease specialist at The Ohio State University Wexner Medical Center, explains. HIV-related weight loss is multifactorial. It can be due to decreased appetite, malabsorption of nutrients, or the body's increased energy expenditure in fighting the virus. Persistent fatigue. More than just feeling tired. While everyone experiences tiredness from time to time, persistent and unexplained fatigue can be a symptom of HIV infection. This fatigue often goes beyond normal tiredness and can significantly impact daily activities. A study in the Journal of Clinical Nursing found that fatigue was reported by up to 88% of people living with HIV, making it one of the most common symptoms. Dr. Judith Currier, Chief of the Division of Infectious Diseases at UCLA, notes, HIV-related fatigue can be debilitating and is often underreported. It's important for healthcare providers to actively inquire about fatigue levels in patients at risk for or living with HIV. The fatigue associated with HIV can be due to various factors, including the body's ongoing fight against the virus, anemia, common in HIV infection, or psychological factors like depression. Night sweats. When your sheets tell a story, night sweats, characterized by excessive sweating during sleep, can be an early symptom of HIV infection in men. These are often described as drenching sweats, where bedding and clothing become soaked. A study in the International Journal of STD and AIDS found that night sweats were reported by approximately 50% of individuals during acute HIV infection. Dr. Paul Sachs, Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital, explains, night sweats in HIV can be caused by the body's inflammatory response to the virus. They're often accompanied by fever and can be quite distressing for patients. While night sweats can have many causes, including other infections or hormonal imbalances, their persistence should prompt consideration of HIV testing, especially in individuals with known risk factors. Oral health issues. When your mouth speaks volumes, HIV can manifest with various oral symptoms, which can be some of the earliest and most persistent signs of infection. These oral health issues can significantly impact quality of life and may indicate advancing disease. Common oral symptoms in HIV-positive men include oral thrush, candidiasis, hairy leukoplakia, white, hairy patches on the tongue, periodontal disease, oral warts. A review in the journal Oral Diseases found that up to 80% of HIV-positive individuals experience at least one oral manifestation during the course of their illness. Dr. David Resnick, Director of the Oral Health Center of Grady Health System's Infectious Disease Program, emphasizes oral health problems, especially those that are recurrent or resistant to standard treatments, can be an important clinical indicator of HIV infection or disease progression. Regular dental checkups are crucial for everyone, but especially for those at risk of or living with HIV, as early detection of these oral symptoms can lead to prompt diagnosis and treatment. Neurological symptoms. When HIV affects the brain, HIV can impact the nervous system, leading to various neurological symptoms. While these are more common in advanced stages of the disease, they can sometimes occur earlier. Potential neurological symptoms include cognitive changes, memory loss, difficulty concentrating, peripheral neuropathy, numbness or tingling in extremities, headaches, seizures. A study in the journal Neurology found that up to 50% of people with HIV experience some form of neurological complication. Dr. Serena Spudik, a neurologist at Yale School of Medicine specializing in neuro-HIV, notes, HIV can enter the central nervous system very early in infection. While severe neurological complications are less common with modern antiretroviral therapy, subtle cognitive changes can still occur and may be under-recognized. Gastrointestinal issues. Gut feelings. Matter. HIV can significantly impact the gastrointestinal system, leading to various digestive issues. These symptoms can range from mild discomfort to more severe conditions. Common gastrointestinal symptoms in HIV-positive men include chronic diarrhea, nausea and vomiting, abdominal pain, loss of appetite. A review in the journal Gastroenterology found that gastrointestinal symptoms occur in up to 70% of HIV-positive individuals at some point during their illness. Dr. Douglas Dieterich, director of the Institute for Liver Medicine at Mount Sinai Hospital, explains, HIV can directly affect the cells lining the intestines, leading to inflammation and malabsorption. Additionally, opportunistic infections of the gastrointestinal tract become more common as the immune system weakens. Persistent gastrointestinal symptoms, especially when accompanied by other risk factors or symptoms, should prompt consideration of HIV testing. Sexually transmitted infections, STIs. The hidden connection. While not a direct symptom of HIV, the presence of other sexually transmitted infections can be an important indicator of HIV risk and a potential sign of infection. STIs can also increase the likelihood of HIV transmission. Common STIs to be aware of include syphilis, gonorrhea, chlamydia, herpes, simplex virus, HSV. A study in the journal AIDS found that the presence of other STIs can increase the risk of HIV transmission by up to 5 times. Dr. Jean Marazzo, director of the Division of Infectious Diseases at the University of Alabama at Birmingham, emphasizes, any diagnosis of an STI should prompt a discussion about HIV testing. Not only do STIs and HIV share transmission routes, but the presence of an STI can make it easier to acquire or transmit HIV. The landscape of HIV treatment has evolved dramatically. Modern antiretroviral therapy, ART, can suppress the virus to undetectable levels, allowing people with HIV to live long, healthy lives. A 2022 study in the Journal of Acquired Immune Deficiency Syndromes found that people with HIV who maintain an undetectable viral load have effectively no risk of transmitting the virus to their sexual partners. Early testing is crucial for optimal outcomes. The Centers for Disease Control and Prevention, CDC, recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine health care. Those with risk factors should get tested more frequently. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, stresses, regular HIV testing is essential for anyone who is sexually active or has other risk factors for HIV. Early diagnosis and treatment can lead to excellent health outcomes and prevent transmission to others. If you're experiencing any of these symptoms or have concerns about HIV, it's crucial to speak with a healthcare provider. Modern HIV treatments are highly effective, allowing people with HIV to live long, healthy lives. Remember, knowledge is power when it comes to your health. Remember, an HIV diagnosis is not the end of the road. With early detection and proper treatment, you can lead a normal, healthy life. The key is knowing your status and taking action.